Hi, in this video, I'm going to be talking about DCIS after mastectomy. Before I go on, I want to invite you to subscribe to our channel. We'll be doing a video soon on DCIS after lumpectomy. We try to cover all the bases. So let me just refresh everybody on what DCIS is very briefly. DCIS stands for ductal carcinoma in situ. And the in situ refers to the fact that DCIS hasn't invaded through the basement membrane. This is what we see under the microscope, and it's non-invasive cancer. Some people might also have this called stage 0 cancer. So in the breast, when ductal carcinoma in situ is seen, and that's all that we see on biopsy, or our suspicion is very low that there's invasive cancer, people will choose mastectomy in some cases, especially if cancer is in multiple areas of the breast, or if they have a larger area with DCIS and a smaller breast. Some people just want to have a mastectomy for other reasons. So a mastectomy for ductal carcinoma in situ is one of the surgical options in the management of ductal carcinoma in situ. So can DCIS come back after mastectomy? It's actually very uncommon. So when people have a mastectomy for ductal carcinoma in situ, if the breast tissue is all removed, it's actually quite tricky for the DCIS to come back. It can, however, if there's residual breast tissue, or if there are a few other features that I'm going to go through. The risk is higher after a mastectomy in people who had multifocal disease, people who at the time of mastectomy were found to have a little bit of microinvasive carcinoma, people who are younger, and people who had positive margins, where the margins were positive or close. But all the breast tissue's been removed, it's hard to go back in, especially after reconstruction, and get that margin even wider. So those are the people who are at higher risk, but even then the risk is still very low. You're actually at a higher risk of having a new breast cancer event, either DCIS or invasive cancer, in the other breast than you are of having the cancer come back on the side you had the mastectomy. It is, therefore, really uncommon for people with DCIS after mastectomy to be offered radiation therapy. Really, the only times this would happen is if somebody had a close or positive margin that could not be, quote, cleaned up, that could not be revised to get a wider margin. Radiation therapy might be offered in that case. What about endocrine therapy, tamoxifen or an aromatase inhibitor? This is really important because the risk of cancer coming back on the side of the mastectomy is so low. The benefit of endocrine therapy in terms of the side that had the mastectomy is so low, it's pretty much unmeasurable. The benefit is greater for people in the other breast. So the main reason people will be offered endocrine therapy after a mastectomy for DCIS, especially with really no worrisome risk factors for a recurrence on that side, is to help protect the other breast. In any event, there's no survival benefit with endocrine therapy. What that means is if you are on endocrine therapy and you feel terrible, we're not achieving our goal of a better quality of life, right? The whole reason to go on it is so that you don't have to go through this again on the other side. You don't need to have surgery on the other side or have reconstruction on the other side, because we're cutting the risk of cancer in the other breast from 4% down to 2%. That's a pretty sizable thing. That means I have to treat only 50 people to prevent one breast cancer. That's a pretty good number needed to treat, we call it. But if all 50 of those people felt miserable on their tamoxifen, let's say, or their aromatase inhibitor therapy, I'm not sure that trade-off is worth it. And when a lot of people hear that, they're like, you're right. If this isn't offering a survival benefit from the first cancer I've already had, that ductal carcinoma in situ, I'm going to stop the medication. Diagnosed with breast cancer? Meet Yerbba, your guide to personalized treatment options. Each option is specifically tailored to the unique characteristics of your tumor. Sign up today at Yerbba.com to take control of your breast cancer journey. I hope this is helpful. Thank you as always for watching, and we'll see you next time.